to discuss another topic to help pregnant women out there to get healthier and fitter. Our today's discussion is on anemia in pregnancy. I am Dr. Mahima Bakshi, the maternal child wellbeing coach at Rosewalk, and today I have a fantastic guest with me, Dr. Lavneena Nadir, who is the senior consultant of obstetric gynecology at Rosewalk. Hi, ma'am.
Hi, Mahima. Thank you for having me today.
It's always a pleasure to have you on the show, ma'am.
Thanks.
So, since our topic is on anemia in pregnancy, let's get started by knowing more about what anemia is.
So, anemia is a global challenge, and 1/4 of world's population is anemic. But of course, pregnant women are more at risk, and anemia in pregnancy is the most commonly seen medical disorder in pregnancy. So, basically, what we mean by anemia is that there's a reduction in the number of circulating red blood cells below the normal level. So, that's anemia.
Great. And ma'am, what are the main causes for it?
Okay, so causes could be deficiency. First of all, deficiency of iron. So, what happens in iron deficiency anemia is that the body does not have enough iron to, make hemoglobin, and so the blood cannot carry enough oxygen to the tissues, and that affects the cellular function. In fact, during pregnancy, the blood volume increases, so the demand for iron and B12 increases because they help in formation of new cells. Then there could be deficiency of B12, and B12 is required to make red blood cells, and the deficiency can cause neural tube defects and preterm births. And then there can be deficiency of folate, because folate is also required to make new red blood cells. So, the interesting thing is these micronutrients, vitamins and minerals, they cannot be manufactured in the body because although they are required in small amounts, so one has to take them in their diet, and one can get them from leafy green vegetables, spinach, eggs, meat, seafood, raisins, apricots. So one must have that diet.
So please make note, ensure that you add all these things on regular basis in your diet, especially if you're a pregnant woman. We want you to have a healthy pregnancy.
Exactly. So this was nutritional. And then there could be hereditary causes like thalassemia. So we screen the patient for thalassemia minor. It could be sickle cell anemia. It could be chronic liver disease, chronic kidney disease, alcohol abuse. And of course, if somebody is not taking enough. So these are the general causes.
Great. And ma'am, what are the
In fact,
factors?
bariatric surgery, vegans,
Yes,
vegetarians.
yes.
So
That's
these are
again
so
another
many
important
causes
point.
for iron
Yes,
deficiency.
yes. So please make note, if you feel that you might be suffering from anemia in pregnancy, ensure that you discuss it with your gynecologist. But what are the risk factors involved?
Okay, the risk factors could be if somebody is already anemic. That means they already have a history of anemia. There is deficiency of iron in their diet. It could be too closely spaced pregnancies. That means, very quickly you have two babies. It can happen in multiple pregnancies. It can happen if somebody has excessive vomiting during pregnancy. And it can happen, of course, somebody is a vegetarian or vegan. So all these are risk factors.
Right. And what are the symptoms that one should watch out for?
One should watch out for, they generally experience tiredness, fatigue, lack of appetite, lack of concentration, shortness of breath, and you can visualize they have pale skin, pale nails, they can have, they just feel tired, they don't look good, and sometimes, of course, they have heartbeat is very fast. And sometimes it can complicate, it can even lead to heart failure in severe cases.
So if we were to discuss about what are the challenges related to the maternal health or the health of the baby, so what do you think could be the maternal child complications involved?
Okay, so on baby it can cause preterm labor, it can lead to low birth weight babies, and in mother it could be shortness of breath, there can be postpartum depression, there can be postpartum hemorrhage, and sometimes, of course, heart failure.
So one really needs to be careful in pregnancy to ensure that they are experiencing overall a healthy pregnancy. So So, ma'am, please also tell us about what is the best prevention and management related to anemia in pregnancy.
So, for prophylaxis or prevention, one must be careful of their diet. One must consume a balanced diet consisting of iron or iron-rich foods, like I said, green leafy vegetables, meat, eggs, pomegranate, dates, beetroot should be a part of the diet. One can cook in iron utensils, and then they can take a supplement which has iron, folic acid, and B12. And of course, if somebody is anemic, we can add another tablet of iron, but we have to ensure that we give it with juice or vitamin C, because that increases the absorption of iron. And two precautions here: should not be taken with calcium, because calcium hinders the absorption of iron, and iron should never be taken with antacids, because that also hinders the absorption. So basically, we should target, if anything is less than 11 gram% in pregnancy, then it is known as iron deficiency anemia. So we must give them a supplement and give them an advice on that.
Super. And any particular way to assess that one is showing improvement in the body while taking these supplements or changing the diet system?
Absolutely. So the follow-up is done. The most common thing is that their symptoms improve, their shortness of breath decreases, they don't look pale anymore, their biochemistry becomes better, and 0.8 to 1 gram% can increase in maybe over 1 or 2 weeks, but in 6 to 8 weeks the hemoglobin should normalize. So that is the way how we assess if there is an improvement. And we can also give prophylactically if somebody is anemic before pregnancy. We tell them to take about 5 milligram per day till for first 3 months before they get pregnant.
Superb. And here I would also like to add one more question. A lot of times pregnant women, when they're on iron supplements, they experience some discomfort or diarrhea or constipation. So in that case, what can the pregnant lady do?
Okay, so if iron is causing gastric upset and a patient is not able to tolerate, then we can look at giving injectable iron, which has less of gastric irritation. And if the anemia is very severe, then sometimes we need to give a blood transfusion.
So that was some great information from Dr. Lavlina Nadir, who's also available at Rosewalk in case you want to consult her in the OPD. Thank you so much for joining in for the session, ma'am.
Thank you.
It was lovely chatting with you.
Same here. Thank you.
So don't forget to visit us at Rosewalk in Panchsheel, South Delhi.